The Catholic Relief Services on Tuesday marks 60 years since the international agency began rendering humanitarian services to the human family. Maimuna Jarju has more in this report.
CRS was first founded in the USA in 1943 by Catholic bishops to provide humanitarian assistance to the deprived and disadvantaged around the globe. CRS is the face of the US Catholic Conference and its bankroll schemes in over 70 countries. In 1964, CRS spread its tentacles to the Gambia, with focus on urban and rural capacity development, agricultural development, microfinance, health and nutrition, malaria control, adult literacy, and numerous skill programs, and HIV and AIDS advisory. CRS assisted impoverished and disadvantaged people, promoting the sacredness of human life and dignity of the human person, without regard to race, religion, or nationality. In the past 60 years, CRS has worked in the Gambia and improved lives across the land. The NGO has provided relief to vulnerable communities, strengthened food security, tackled malnutrition, enhanced healthcare services, and provided education opportunities for children and their families. CRS commemorated its 60 years of existence on the theme, The Journey of Resilience, Empowering Communities and Transforming Lives. The commemorative event, attended by senior government officials, representatives of UN agencies, members of the diplomatic and consular corps, and CRS staff, was held at the Sadauda Kairaba Jawara International Conference Center in Bijulo. Mohamed B.S. Jallo, Vice President of the Republic of the Gambia, in his speech, laid special emphasis on CRS' continuous collaboration with government in serving vulnerable communities through strengthened food security, enhanced healthcare services, and improving lives and livelihoods across the country.
These interventions align with the government's recovery-focused National Development Plan, the YIRWA, also support the realization of the ideals of this national blueprint, whose overarching goals are to consolidate gains in democratic governance, accelerate green economic and social transformation, and build resilience to shocks and crises. CRS's initiative, therefore, resonate particularly with Pillar 1, that is community resilience and shocks and crisis, and Pillar 6, empowerment and social inclusion, leaving no one behind. In the health sector, CRS has been instrumental in improving access to quality healthcare services, especially for underserved and remote communities. Their work includes building and renovating health facilities, training healthcare workers, and leading impactful initiatives such as the fight against malaria through the Global Fund. These efforts have significantly improved health outcomes and enhanced the well-being of our population. In agriculture and food security, CRS has empowered farmers by providing training, resources, and innovative techniques to improve productivity and sustainability.
In welcoming remarks, the country manager of CRS, Dr. Amulai Toure, reflects on some of the milestone achievements of the CRS in the past 6 decades.
From 1964 to 1969, our main activities focus on general relief through the distribution of food, medicine, and clothing. From 1970 to 1973, food distribution was expanded in response to the severe drought that affected the Gambia some decades ago. And this program was expanded to include school lunch for school children across the country. By 1972, over 30,000 Gambians were benefiting from the food program across the country. Between 1974 and 1988, the government and local communities demanded the expansion of our nutrition program due to the severe drought and famine that affected the country. Additional funding was secured from the United States government to implement the health and nutrition program, targeting mothers, children under 5 years old, and other vulnerable groups of our society. The programs focus on growth, surveillance, nutrition education, and supplementary food packages to the needy. An additional 43,000 beneficiaries were reached through these interventions. In the 1980s, the collaboration with the Ministry of Agriculture and the Ministry of Local Government were strengthening, and the agricultural program was launched with the support of the US government again, complementing the National Health Nutrition Program by encouraging the production and consumption of homegrown crops.
Dr. Toure explained that CRS and its partners with funding from the Global Fund has worked with the Ministry of Health in the fight against malaria.
From 2003 to date, CRS and its local partners, namely HEPDO, which is the Health Promotion and Development Organization, ADWAC, which is Agency for Development of Women and Children, and Caritas de Gambia work closely with the Ministry of Health in the fight against malaria with funding from Global Fund, KOICA, which is the Korean International Development Agency, and of course CRS Private Fund. Our efforts has been multifaceted and far-reaching. The digitization of bed nets, which is adopted worldwide, was initiated in the Gambia in collaboration with the Ministry of Health. This was a major milestone again for the world, which revolutionized the use of bed nets. We have distributed over 4 million bed nets to the people of the Gambia through our local partners, thus significantly contributing to reducing malaria incidences and morbidity.
Jennifer Overton, CRS Regional Director for West Africa, said, "The 60 years anniversary is not just a celebration of years, but a testament to lives touched and communities transformed and hope rekindled."
More than 60 years ago, CRS arrived in the Gambia with a simple yet profound mission: to serve the most vulnerable, guided by the principles of human dignity and social justice. CRS was invited by the Bishop of the Diocese of Banjul in 1960, and the Gambia welcomed CRS with open arms and allowed us to register in 1964. Together, we have built a partnership grounded in trust, respect, and unwavering commitment to improving lives. We extend our heartfelt recognition to the Catholic Church in the Gambia, whose leadership and unwavering faith has been a cornerstone of our journey. In particular, we thank the Catholic Bishop of the Diocese of Banjul, whose wisdom, guidance, and prayers have continually strengthened our efforts. We also owe deep gratitude to the government of the Gambia for their support, guidance, and collaborative spirit, which have been instrumental in enabling our mission. Without those close partnerships with the government, with faith-based organization, donors, and civil society organization, CRS would not have been able to improve the lives of millions of Gambians over the last 60 years.
Larry Degnazi is the U.S. Acting Deputy Chief of Mission, and according to him, the U.S. government through CRS made significant contribution to agriculture, health, food security, and emergency response.
CRS has been able to make significant strides in agriculture, health, food security, and emergency response. The U.S. government has funded projects led by CRS to the tune of more than $130 million in their 6 decades of existence in the Gambia. The most recent grant funded by the U.S. Department of Agriculture, USDA, is the McGovern-Dole Food for Education project. So far, CRS in the Gambia has served over 5 million meals to more than 53,000 children in 186 schools across the country.
The commemorative event climaxed in a cake cutting and a delightful performance by the Gambia's Kora Maestro Jaliba Kuyate. For Star TV News, this is Maimuna Jarju.